Hello and welcome to Workforce Wisdom. I'm your host, Christy Bray, Chief Customer Officer at PracticeLink. This podcast examines the latest trends in healthcare recruitment, showcasing innovative strategies, success stories, and fresh perspectives that are shaping the healthcare workforce. These episodes will lead to in-depth, thoughtful discussions with recognized industry-leading healthcare professionals, exploring the challenges of healthcare recruitment and beyond. Whether you're an experienced recruitment professional or just starting out, this podcast aims to help you discover how experts are reshaping the industry, leveraging technology, and fostering inclusive hiring practices. Today's episode of Workforce Wisdom, Insights on Leadership, Innovation, and Impact, with Kris Olson. Welcome to the show, Kris.
Hello, how are you today?
I'm doing great. For our listeners, Kris Olson is the Senior Director of Physician and Professional Services at Essentia Health, where she has served for more than 22 years. Based in Fargo, North Dakota, Kris oversees physician and credentialed practitioner recruitment, professional staffing, including internal and external locums, and physician employment. Her team not only searches for the best and brightest providers, but is also responsible for their credentialing and ongoing employment through the due diligence processes. With a proven history of leadership in recruitment and workforce management, Kris brings deep expertise and insight into the evolving challenges of healthcare talent strategy. Welcome again. So Kris, can you walk us through your career journey and what led you into physician and professional leadership at Essentia Health?
All right. Well, it started 22 years ago. I worked for an advertising agency in Fargo, North Dakota, and that ad agency was brought into the organization to focus on a heart and vascular campaign. At that time, I was going up probably against 6 or so other ad agencies and ended up winning the account for heart and vascular. So every time I came into the facility, their marketing person would say to me, "Hey, we have an administrator of marketing and strategy position open, and you should think about applying." And at the time, I worked in this great ad agency where the walls were purple, and I brought my 2 black labs to work every day. And I thought, why would I want to go into a facility versus having that sort of background? But as time went on, I discovered they had this great story to tell. They had this great organization, but they couldn't clearly articulate their mission and vision, not only through marketing, but for how they were talking to people. So, long story short, ended up applying for the position of Administrator of Marketing and Strategy for, at the time, Innovis Health, which evolved into Essentia Health. And then as time went on, took on different roles and responsibilities. So 22 years later, here I am in
Yeah.
recruitment.
Well, and I think the best, recruitment folks that I know, you've got a sales background or maybe a marketing, communications, even journalism. A lot of journalism
Yep.
majors that ended up in this industry.
I would agree, and a lot of my team has that sort of background too. And part of it is when you look at the mission and vision. So, for example, at Essentia Health, our mission statement is here to make a healthy difference in people's lives. And the ability to translate that into a vision for people who are joining the organization and to clearly articulate that, that resonates. So each of the people on my team, as part of our exercises, we always ask people, what's your story? What is it that drives you and makes you passionate about this work? And I truly am someone, if I don't believe in it, eat, sleep, breathe it, I can't do it. And so for me, it was really wrapping my arms around that mission and vision and being able to articulate it.
Yeah. So from those first days, as you came into the system, and it sounds like you went through merger or acquisition of
Yeah.
some point. So those are always fun. What are some of the experiences that have shaped, your leadership style the most? And you cover, they're integrated, but they're diverse in their challenges. Recruitment, credentialing, staffing, like they're
Yep.
integrated, but different. But give us a little bit of, some of that experience that shaped you.
Yeah. When I first came into the organization, I had oversight of the gift shop, the cafeteria, patient relations. I helped start the foundation. I helped start the process excellence program we had. I had patient complaints. I had physician quality. So that career path, because it was a small facility and you know how you end up with the other duties as assigned, that's kind of where it went. So those early years, I would say the biggest thing that contributed to my growth or my understanding of where I am now was kind of being a utility player and stepping into it. I always tell people who ask me now, college students, students, how did you get where you're going? It was never saying no. I had an attitude that was, well, how hard could it be? And walking into it and really understanding it. So those early experiences really helped me focus on what's important in healthcare. And those early experiences, when I look at patient relations, that was a really hard job to do because you're dealing with people that aren't looking for the outcome they got, or they didn't accept the explanation they received, and how do you walk through it? So that really did a lot for me to understand not only where was the patient coming from, why was that communication important, but also understanding, again, going back to the mission and vision of the organization and how they were supporting that. So it gave that view, and that's the other part in healthcare recruiting. It's a three-legged stool, right? It's what we require in recruiting, what the organization wants or needs, and then what the candidate wants or needs, and how do you put all three of those together? So really putting myself in each one of those positions. I've been a patient, I have been on the organizational operational side, and then the recruiting clinical side with physician quality, understanding why all those pieces are important. So without knowing it, I had the perfect pathway that led me to where I am now. I look back on that, and I remember when my mom was still alive, she would ask me, "What do you do there?" I, it was really hard to explain. Now I know I could have a different conversation with her, but I was really grateful for the organization and the opportunities I've had to build upon it.
Yeah. My dad will sometimes still, less now in my role, but he will call me a headhunter, which the
Mm-hmm.
headhunting is, or a matchmaker. That's probably where
Yeah.
I land on matchmaking.
Yeah, matchmaking, because that's the other piece I have learned over the years. I do think we have the ability to sell ice to Eskimos. That's the phrase I always use. And I can either use those for the benefit of good, and that's what I choose to do. And part of that is the ability to paint the picture and to help people understand. There are people that would say, yes, I can get you to join the organization, but at the end of the day, it has to be the right fit for the right
Mhm.
person at the right time. So when I say use it for or good of otherwise, I want to make sure it's the right fit. We
Mhm.
want the highest quality people we can, but they have to be the right fit. So having that dialogue is very important. So I think matchmaker is probably a better
Yeah.
terminology
Yeah.
than headhunter or other.
Yeah.
My dad always used to ask me, "Did you hire that doc? Did you hire that doc?" And I'd be like, "Dad, we don't need to tell everybody."
Right. Right. Especially if there's an issue, you might then you'd be like, oh, yeah.
Usually it was during an appointment where I'd be like, "Dad, stop."
Yeah. Right. Right. I liked another piece you said that never say no. And in my background as an administrative assistant early on in my healthcare career, that type of attitude I think has just led me to
Hmm.
unbelievable spaces for me to work in and rooms to be in, tables to sit at, because I don't have all the answers, but I can help figure it out. And you want to be that resource. And I think that's a huge part of how what you just said with that stool is how you can find them and bring them in, but then also, that retention side,
Hmm.
and then being solution driven.
Totally comes with time and experience, right? Is the ability to sit there and to have the organizational support to empower you to have those solutions as well. But you're right. Never say no. I was just at an event the other night. I don't get to go out very much and do the actual recruiting, but when we're short a person, I get called up, so to speak. So I had the opportunity to be at an event that we were hosting, and I had a younger recruiter standing next to me. And when we got done with the evening, she turned to me and she said, "Oh my gosh, did I learn a lot? Don't ever say no." And I'm like, that's it exactly, right? You always want to keep the door open to have a
Mhm.
dialogue. We can have the conversation. But one of the pieces I believe are in my skill set or my toolbox that are the strongest is the ability to say, huh, let me think
Mhm.
about that. And then give me 24 hours. Usually within 24 hours, I can sit and think about what's a better angle to see this from, or how can we provide a solution to this. And where we're going right now in the world of recruiting, we're in a
Mhm.
rural area. We can't afford to say no. So if someone presents to us, it's hang on, that may
Mhm.
not have been what we originally were
Right.
looking for, but let's think outside of the box and figure out how could we make this work.
Yeah.
And that empowerment is huge for the team. I like being at the spot I am now in the organization and in my
Mhm.
experience to be able to sit back and say, no, trust me on this one. I think we can make this work.
Yeah, I think that the great example there, one of the things, I would ask the teams that I led, really the candidate comes and they, it's not as black and white. This is not it can't, it shouldn't be an 8 to 5 Monday through Friday.
Right.
Like, it shouldn't be that way, because our providers, and especially our physicians, are asking for more, and they deserve more from a work-life balance standpoint, and those types of things,
Mm-hmm.
where for them, that fulfillment that they get out of coming to work. And so I think it's important that people think about that. Sure, you've got a job description, or you've got certain things on the list, but like 4 out of 6 is probably pretty good.
Yeah,
Right.
right.
Yeah.
Yeah, I usually start out the conversation, if the Earth, stars, and moon aligned, what is it? And then we
Yeah.
work our way back
Yep.
from that. Because everyone has a point of, here's my ideal. This is the piece that I've dreamt about for years and years and years. But then you do have to walk through it and say, okay, there's got to be a little flexibility here, a little give and take. And that's part of that negotiation process. And then at the same time, how do you build trust and faith and confidence that we're not just saying it, that we live it and we're going to support it? And that goes on both sides of the fence, right? It's not just for the candidates, but when we talk about that employment side, how do we work with them as they are in the continuum of employment, but also for our staff, right? For my team, how do I have that dialogue so they recognize too, it is a 24/7, 365 job if you're a recruiter. And how do we find work-life balance in that and flexibility as well?
Yeah. Have there been any, technology solutions, or some other innovations that you might have put in place for your team to help them manage that? We do hear that a lot in terms of burnout from recruiters and folks we work with.
Yeah. I always tell my team life comes first. And whatever point, I want you to be the best recruiter you can possibly be, but life comes first. And so for the guy on my team whose kid runs cross country and plays baseball, you got to go do that. You get one shot with that crew and you have to focus on that. For others on my team, it is, I had someone this morning who said, my dad fell. I'm not going to be in.
Mhm.
Good, go. All those things are so important, because to that burnout, to that where we are in life, trying to figure out how we keep all the plates in the air and how do we manage all of it, that's so important. But some of the technology, like this is super cool, right? I'm sitting in Fargo, North Dakota in my basement, and you're somewhere outside of Nashville, and we can still have this kind of dialogue. And if you and I blurred our backgrounds, you'd
Right.
have no idea if I was sitting in the office or in the parking lot or in my car. We've all
Yes.
had those types of conversations as well. So for my team, it is, where do you need to be? How do you adjust for time zones? That's probably our biggest challenge right now. All of my recruiters sit within the footprint of Essentia Health because we do
Okay.
require them to be on
Hmm.
site. But as we speak, I've got one somewhere in a motorhome going across the US that's plugging in at the local campground and doing her work. So that kind of flexibility is
Yeah.
super important. So I think that kind of technology. I'm also big on, you have to think about, you manage your schedule. I think the workforce, the physicians and the credentialed practitioners we're talking to, they're in the same spot we
Hmm.
are, right? We don't have to talk to you at 9 o'clock at night. Let's figure out when's the best time. Now, however, maybe 7 o'clock Saturday
Hmm.
morning is the best time for both of us. Then let's figure out how to have that dialogue. But it's a lot more flexible than it used to be.
Yeah. Yeah, yeah, I would agree. And I think what you're seeing in terms of a team structure, and the folks that are the most successful, understanding that, and it takes time. I remember when I first, it's been at least 12 years ago, but whenever I first went fully remote, before anybody else was doing this, was a long time
Hmm.
ago. And for me, learning how to self-manage my time, and knowing I either had a 7 p.m. work event or I had a 7 a.m. work event, what that meant to my day, and having a boss that understood, yeah, you're not
Yep.
working that 14-hour day, figure it out and adjust. Equally, like, we put our teams on the road a lot.
Hmm.
So how do you give them some of that back?
Right, because most of those things happen on weekends or whatever the case may be. And so,
Right.
how do we
Yeah.
do that? For us, we were always in the office, but COVID certainly changed that for all of us, where we quickly had to, I felt like we were evacuating, right? And get home and then figure out how we made this work. And that's something else that all of them have figured out along the way. Where do I best work? And one of the
Mhm.
things we had to talk about early on, and we still talk about, is, you need to get out and touch the earth. Get out and walk. walk, get out and take a deep breath.
Mhm.
We have to be very deliberate in how we schedule team events. The person that I was at this event with the other night, she's been on the team for I don't know how many months. I've never met her in person.
Mm.
So the opportunity to stand next to each other and build that relationship, because in recruiting, in healthcare, relationships are of utmost importance. So how do you weave that in so you've got it? And
Mhm.
you don't realize how this is good, but it's not as good as when you're standing across from somebody. And, oftentimes I'm always floored when we meet people because the first reaction I get from most people I meet is, "Oh my gosh, you're taller than I thought you were." And so that perception that we put along with it. So that is another piece that we've really had to be deliberate with the team is every once in a while we have to get together in person so that we can sit across from each other and talk
Yeah.
because that's so important.
Yeah. Yeah, I agree. I think that I work at a much different pace when I'm here,
Hmm.
at home. For me, it's a faster pace where I'm less distracted and things are happening. But it is, that intentionality of getting folks together for a purpose and a reason. Don't just bring them in for even a lunch
Yep.
nowadays is not a good enough reason, especially if you've got really driven people. There's eating lunch with the group for 2 hours when all they're thinking about is, oh, I could be calling that person, or I
Yep.
have this many emails. And so it's a fine line between making sure it's intentionally driven
Yep.
when you do those activities.
And the value add to it, absolutely.
Yeah.
Same with site
Yeah.
visits that we do. Some
Mhm.
some people will come to us and say, "I don't have that kind of time. What can we do virtually and still make it meaningful? And
Mhm.
how do we bring the ones in that it does make sense?" And again, same sort of concept. How do we adapt and
Mhm.
adjust? How can we be more nimble than we've ever been in the past to meet people where they're at so that we
Mhm.
can have the most meaningful experience with them?
Yeah. I'm curious in the winter, this is not on script at all, but in the winter, just because I've recruited to Wyoming before. And so once the snow started flying, we just stopped. We really did not do site visits kind of November to February because, even into March you would get weather
Mhm.
and they couldn't fly in, they couldn't land. Do you guys adjust in that way where you live?
Surprisingly, a lot of the candidates, obviously, that we have coming into this neck of the woods are familiar with it and they know what they're coming into.
Okay.
So we do have moments where people get stuck in airports and we're shuffling the deck. But I think
Mhm.
last year, maybe we only had one candidate that didn't get here because of a delayed or canceled
Mhm.
flight. But typically we build that in. Here's what's coming. We're watching the weather, which is such an interesting thing, right? You're not just a recruiter, you're also a weatherman and a
Right.
travel agent and, all the other things that go with it. So looking at that, we do community tours, and all of our realtors have four-wheel drives and things like that. Every once in a while, we'll get someone who says, "Well, I want to try driving," and that's where well, where are you from? Are you aware of what ice and snow? I'll never forget a couple of years. Well, this is probably more than a couple of years ago. We had a candidate who had to drive to a different location and insisted that they drove, and they ended up in the ditch because the
Mhm.
roads were not good. But they signed with us, and the number one reason they signed with us was that they were overwhelmed with the number of people that stopped to offer help. And so whatever the case may be, again, right, you react and you adapt and adjust. And we are very grateful for the communities in which we serve. I mean, that's a good reflection back on the organization too
Mhm.
for what it means to the community. I don't
Yeah.
recommend that strategy, by the way, but it worked in that particular case.
Some people have to experience some of those things on their own
Hmm. To understand what it's like. Yep.
to understand what it's like.
Yep.
I know we mentioned early on that you also lead staffing in terms of locum tenens coverage, but from your vantage point, what is the biggest workforce challenge that healthcare organizations are facing right now?
Oh man, aside from the same shortages that everyone's got, right? I think there's a couple things we have to think about. We have to think about, and I read the stat somewhere for everyone leaving the workforce that's
Mm.
retiring, what is it? 1.2
Eh,
to 1.5 that we have to replace them with to make
yeah.
up for because more and more people aren't joining the workforce as a 1.0 FTE. Maybe we're posting for that, but they're coming in at a point 0.8 or at a point 0.6. So I think some of the things we have to think about is what is the volume of candidates we need coming in that are actually going to sign and fulfill whatever financial and long-term planning the organization has. I think the other thing that we're challenged with is looking at what are the models of care? How do we need to change some of our our models to make sure that we're addressing the access and the needs that patients need. And then how does technology dovetail into that? How does telehealth come into that? You
Mhm.
know, we have DAX or whatever the scribing services are
Mhm.
that they have available. But how are all of those tools going to complement and enhance the challenges we're going to have to find the candidates that we need in some of these locations? And then how do we find the one in a million? You know, Fargo, North Dakota has a hyperbarics physician who's board certified. I mean, it's the coolest thing in the world, but hyperbarics, wow. I mean, the technology that we have going out there in medicine too, and how are we going to keep up with that and find the providers that we need? So I see that. I see obviously financial challenges are going to continue to be there, that as organizations, we're going to have to adapt and adjust constantly to that. But it is a very complex problem. I remember
Mhm.
the days when, and this is aging me, when maybe we had one or two candidates, you know, on a quarterly basis, and we were really excited about that. Now we have to go further up into that pipeline, right?
Mhm.
We're not only we're looking at anyone who's graduated from high school and you're going to go to med school, so that your window is now 1 to 7 years for how
Mhm.
you might be getting anybody in med school and on. But we're going back into the undergrads even, and how do we connect into that, and how do we find grandma's grandson, neighbor's kid that's interested, and how do we keep track of them? So I think we're going to be challenged with that continuing to move forward.
Yeah.
Did you know PracticeLink, the nation's most trusted physician recruitment resource, now offers PracticeLink Pro Marketing? PracticeLink Pro Marketing is a brand new powerful recruitment sourcing solution built just for healthcare organizations. With custom strategies, targeted reach, and data-driven results, PracticeLink Pro Marketing helps you attract top-tier candidates and fill hard-to-reach roles faster. Ready to elevate your recruitment game? Visit PracticeLink.com and schedule your free consultation today.
Now, do you serve in terms of communities, across the area there from a diversity perspective? Are you able to find, candidates that match your community?
We are. We've never had an issue. I mean, obviously, this ranges from specialty specific that's needed. We always make sure that there's a connection. Some of the things that we've talked about in terms of challenges of weather, how do you have access to airports so that you have access to family? Obviously, we have immigration that we are aware of as well. So we're trying to find as many connections. We have the benefit in all the locations that we serve that we are very diverse communities, both in industry and education. So there's a lot of connections in the community that we reach out to help people feel welcomed. Personally, if you ask me what are the three things I value the most, it's my family, my relationships, and my health. You know, so making sure we're asking people, how do we navigate those things that matter to you so that we can connect them in, so that we feel welcomed, we feel a sense of community? Because it's really hard to recruit someone who doesn't fit that and then turn around and say, this is our expectation of the organization, right? You didn't feel it from us, but we expect you to do this into the community. So really focusing time on what resonates with them. And that can be anything from, religious beliefs and places of worship to food to how do I fly out of here? My family isn't going to live here, but I'm going to come in during the week and fly out on the weekends. So making sure that, again, meeting people where they are and understanding
Right.
what their needs are.
Right. Yeah. And I think with that, we go back to the thing we started with about the flexibility. I mean, I've worked with CEOs that, they're adamant that provider, that physician has to live in the community.
I don't know if that's going to happen anymore. Not when you're looking at some of the specialties we're looking for.
Yeah.
And again, we have the benefit, our major hubs are in places that have, airports that they're able to have access to and things like that. But that's something we have to continue to look at and be nimble too. And some of the specialties we're looking at, people are saying, I want to work remotely. This is their medium. So how do we make that work as well? Not only from a staffing perspective, but from a patient perspective. And then, of course, we have all these other things like Joint Commission and regulatory and centers of excellence. Like, what are all the criteria that we have to make sure that we're incorporating all of that into any model as well?
Right. Right. Yeah. I think it's important too that as recruiters learn, those that are new on the job, as they learn some of these nuances, that there's a lot. I'm sure that person that stood beside you the other night, that's a lot of what you you just get over time of being in hospital operations and seeing that. And for me, the patient being served and taken care of is the number one goal. Don't care if it's a locums person, it's a
Right.
part-time person, none of that matters to me if that's me or my family member that's getting care, because that person is in place.
Absolutely. And then making sure that we have outfitted that person to clearly understand what our expectations are, right?
Sure.
So that orientation process then becomes very important. So you referenced, I have physician perm, but I also have locums and staffing. Those follow the same process for us because it's
Mhm.
that important. And to your point, wherever you came from isn't the issue. It's the access and the quality of care that you're providing and the communication you have with the patient. So how do we as an organization arm people to be able to walk into that scenario and be comfortable and
Yeah.
to be able to execute on what our service standards are?
Yeah, definitely best practice to have locums onboarding.
Yes,
Definitely best.
100%. And it's so funny. It was a couple of years ago that I was asked to be on an advisory board for a locums company. And in talking to the locums, one of the first things they said is sometimes we come into a facility and no one's even told us where the restrooms are.
No.
And you think about that very basic level and you're like, oh my gosh, how did we miss that? So going back through that and making sure it's the old making the peanut butter sandwich, right? Are the
Mhm.
instructions so complete that if I read them to you and made you follow every single step, you could truly make a peanut butter
Right.
sandwich? Yep.
Yeah. Yeah, I think that key of like having somebody meet them on their first day, like just it's one little thing,
Yep.
from a high touch perspective that makes a huge difference. And you're asking these people to come in and care for other people
Hmm.
and your patients. And so I think that it does warrant your time.
Yep.
And again, where you are, I think it could be difficult to attract people, even as a locum, to
Right.
come into the area in the winter.
Yep.
I'm not signing up for that job. First of all, I'm not coming. But I think that that's another barrier where you have to go above and beyond in terms of a place they want to work and they come back to
Yep.
consistently.
Well, and that's it. And the same thing, regardless of what the climate might be, people will come back if you're treating them with respect and you're outfitting them to be successful. So again, early on in my career, all of that work that I did in patient relations, the number one thing that I learned was however you treat people, whether it's an explanation of a bad, you're not going to get what you want, but here's the why, and you treat them with compassion and empathy, and sometimes that is sharing bad news or saying no. But that is so important, and we have to do that all the way through the organization. So same with the people we're hiring, the people we're not hiring. Every time we turn someone down, we always want to follow up with, we wish you the best of luck with wherever you're going. Here's something to think about, as you're going to the next place, or here's why, just so that we're also helping to improve healthcare for awareness for anyone that's doing anything else. And I think that's part of all of us in the world of healthcare. That's part of what the mission is we need to do, is what is it we're always sending out into the world, not just those we're attracting, but those we also aren't taking. What is the feedback we can give them to help them be better at what they do?
Yeah, and I think that equally the people you interact with day to day
Hmm.
inside your organization,
Hmm.
remembering those things, because you get comfortable with them.
Yep.
From a relationship standpoint, I think that you can easily roll right through some things, and instead of like taking a step back and going through that.
Yep. Or asking people what's going on. This isn't typical behavior for you. And I know I'm not saying to violate any HR things or anything like that, but to pause and get the human component in it again, to understand, because everybody's got something going on in their life right now. And how do you manage that and how do you balance it?
Yeah, yeah. So you've been described as a collaborative and strategic leader, and obviously, I mean, this conversation for the listeners, we're so off script. Like, it's amazing to just go through and have this type of flow with a guest. How do you approach building and sustaining, the high performing teams and the work that you've done there for a couple of decades?
Gosh, I am in such an innovative organization. So right out of the gates, we are a dyad-led organization, which means that our president, our CEO, let's start up there. Our CEO is a physician who practices, and then all the way down through that structure, there's an operational person tagged with a physician. I have a dyad in recruiting, and that is so important. So we have huge engagement of our division chairs, our section chairs, our physician leads. And that collaborative model is what makes us as successful as we are. It not only brings the focus of patient access, but it also brings everything that we've been talking about. So we never lose sight of what's the patient concern, what's the clinical concern, but we always have that operational piece as well. And it helps you really develop that strength in collaboration. Our physicians, by the way, they're all the way through the process. We have physicians that screen candidates. We have physicians that do admin overviews. We have physicians that show up for every interview, all the way through that process. And in fact, we just are going through an assessment, right? Because every once in a while you have to pause and say, are we still doing this well, or where do we need to tweak? And we had brought forward some recommendations that we had one of the physician leaders go, hang on, slow down. Here's some pressure points we have to think about in order for us to maintain kind of a white glove service and what sets us apart, and how do we want to be known. And I'm grateful for that,
Uh-huh.
because that's where you really truly, you have to stand back and look at that collaboration and look at it differently. I also recognize that there are times that no one wants to talk to me. They want to talk to a peer-to-peer
Yes.
physician. And so having that at our fingertips is huge. And they go through training, we
Mhm.
arm them with the details, and vice versa. We learn from them. I have this great story of one of the docs I worked with. He's one of our CMOs, and he's an interventional cardiologist. And I get on one day and he's asking me, how are things going? And I said, oh my gosh, I have an uncle who needs a stent placed. And I'm talking and he goes, well, Kris, that's what
I
I
do.
do, right? And I'm
Yeah.
like, really? I forgot you have another gig off to the side, right? So that kind of collaboration and relationship, though, just is so beneficial to everything
Mhm.
we do.
Yeah.
But it really teaches you the fine art of collaboration, right? Because we get so stuck sometimes in the process, regulatory, check the boxes, and then to bring that human component in of your physician partner, where they are saying, hang on, we got to think about how will this work in the practice? What's the skill set? What's the fit? It really does balance things out for
Yeah.
us.
I think I worked in a similar collaborative approach with Banner Health, and having that dyad partnership.
It's huge.
It was huge. Where I
Yeah.
did, I that those physicians were right there at the table, and the support. You've said this a few times, but it's important to have the support of the organization, the leader that I worked for. Like, she really empowered you. You had that direct access where I could
Hmm.
say, hey, you haven't called this guy for 2 days. So from a candidate flow perspective, if you do have that
Yep.
physician leader that's calling
Yep.
folks, or an administrator, they've got to be quick. You've got to be able to knock on their door or send them an email and say, I need
Yep.
you to call
Yep.
them right away.
And that comes along with a lot of trust, right? To kind of move things around. The physician that I collaborate with the most, even to the point where physicians come back to her and ask questions, she's got confidence. She'll pass it up back to me and say, this is not my area of expertise. Kris is going to answer this for you. And so that type of relationship just makes a difference it makes it so much easier, I guess I would say that, as you're trying to onboard people and in the competitiveness of what's going on in the workforce today. That makes a big difference.
Yeah, for sure. What advice would you give to, some emerging leaders or recruiters, if they come into talent acquisition or workforce strategy, and I think both of our paths were not
Not
great to
straight.
get
Yeah.
here. So, what advice would you give those folks?
I would tell people to get to know every angle of the organization. It has been a huge benefit to me to know where the loading dock was for a tour, to understand who the ER docs are, what are the services we provide. And those things aren't things you learn right out of the gates, but it's attending meetings, it's going to events, it's networking within the organization so you're building that relationship. Figure out how you keep track of who's who. I can't, and I'm sure if I asked you this, you wouldn't be able to say it either. I don't know anymore how I'm able to remember the name and the face, but I do. And I have my own tips and tricks for remembering, oh, that's so and so, and this is what I remember about them. But building on that type of relationship, I would tell people learn about what is an RVU, why is it important, what is the margin of the organization, why is that important, what are your top initiatives, all of those things that not only make a difference in the world of recruiting, but help you be comfortable in the bigger picture of having dialogue with people. And, in the recruiting world, we are privy to a lot of conversations that not everybody gets to sit at that table or have that dialogue, and really understanding what it means. So, I go back to, and it was my dad, by the way, who always used to say to me, well, how hard could it be? And that has carried with me all these years. It's that pause. I'm not telling you to overload yourself and drown yourself in all of it because that can be overwhelming, but to really read up on it and figure out, do I know my organization and do I understand what we stand for? I also would tell people if you don't believe in it, you're not going to be able to sell it. So make sure you know what your healthcare story is. Why does this work for you? And why is it important for you? Those to me are the best recruiters who can clearly say, oh, yep, this is why I chose this profession. Because you and I both know it is a little bit of an adrenaline junkie to be a recruiter, and it's fun. It is the biggest impact I believe you can make in healthcare is what the work we do, but it can be exhausting. It can have a lot of pressure associated with it because the organization is so dependent on it for access and financial stability and quality and all of those things. But get into it and really understand and find
Mhm.
someone who's willing to mentor you and let you tag along behind them, to see it, to be it.
I agree. I think that's where been blessed throughout my career to really be immersed. One of my first offices in the hospital was an old bathroom, but it was outside of the surgical neurointensive care unit, right next to the neuro unit, and I think that type of exposure, doing some of that shadowing at the hospital or the clinic, if you're recruiting and you hear these acronyms, CABG and ECMO, and you said hyperbarics, if you don't know what that is,
Yeah.
you can't communicate that, I don't think, in a logical way to a physician who's gone to school for many years to be that.
Yeah.
So yeah, I would agree. I mean, I've been in the OR, been in the ED, like absolutely.
Take
Yeah.
advantage of every opportunity available. Yep. Understand the comp. That's the other piece to this is oftentimes the recruiters will come and say, well, I know if we paid this candidate more, or if we gave them more of a bonus, we would get them to, we'd get them to sign. Understand what that means. Everything we do has an impact somewhere. So thinking through what we can or cannot do, why we do or don't do, understanding the why. The other piece I think that you and I are probably learning along the way, change management used to be an action plan, right? That you would map it out and you'd put it on a timeline and we had all these nice things. Now change management is happening every day when I get up. Something's changed and I'm like, oh my goodness, we have to adapt and adjust. So really being someone that can be flexible and nimble and I noticed the difference in me. There are some things, much like with what we grew up with, your parents instill upon you something, and then you realize at some point in your life, well, that didn't serve me well. I'm going to change my thought on it. It's the same in any profession you have, is understand the why and where are the guardrails for when we would ask to do something different or how we would ask to do something different or pulling the cord on the
Mhm.
bus to say this doesn't feel good and here's why. I think those are things that we have to help people along the way with too.
Yeah. Yeah, for sure. We've talked a little bit about, some innovations, including technology. Is there a shift that you think, may redefine the healthcare workforce as we go into this next decade? We've talked a lot about work-life balance, but
Yeah.
anything else you can think of?
Is AI. You and I were talking about it before we got on today. AI is just fascinating. And the piece about AI, and you said it, and I've said it too, it only is as good as we train it or teach it or learn it or prompt it. So, really understanding what is the intent of it and how are we going to use it and how do we use it to our benefit. Yeah, there is a huge benefit in what it's going to do for us, but we also have to still understand it. It's not a substitution for
Mhm.
who we are. And I think, in everything we're looking at in terms of healthcare, radiology talks about AI, docs talk about it in the office as far as Epic or whatever medical record they're on that's, communicating with them. We're talking about it as far as how do we assemble profiles and put it into whatever chat GBT we're using to have it coalesce or fine tune things, but you still have to be in control of that, right? So it's understanding how we're going to use it. I think we're going to see it just boom here so quickly, and keeping on top of it is a little overwhelming too. Like you already feel like you've missed the boat, right? So what's the best medium? How do we filter what does or doesn't work? Because for everything there's good, you can also list something that didn't go as well, right? So still having that control over it, but I think that's going to be one of the
Mhm.
biggest things to see coming out. I had the opportunity 2 years ago to go to the big radiology conference in
Uh-huh.
Chicago, at the McCormick Center, and I just remember walking in going, "Oh my goodness," kind of having this overwhelming feeling of this is where you realize
Yeah.
how fast healthcare, and that's just one example. I'm sure if you go to any other robotic or whatever, it's that, but just how fast the technology is changing.
Yeah, I would probably say radiology. And then if you looked at, some type of the surgical or something, if you got into robots and things
Yep.
like where you see the immediate impact.
Yeah. That and that's going to be a challenge because when we're recruiting every candidate coming
Mhm.
in, do you have a robot? Is it this one? Because when you look at what their training is, so
Yeah.
then also understanding how does the capital process work and can everybody go out and buy every robot they need? That's going to be another challenge for us moving forward is what they're trained on versus what facilities have access to.
Yeah. And when in some cases I've had it come down to the EMR because
Mm-hmm.
I will not name it, but we were on a terrible EMR, and they're all training on Epic
Yep.
in their academic
Yep.
training, and that's a huge differentiator. I've had candidates say no, thank you,
Yep.
because of the EMR.
Yep, because they're that. The other part for me that's changing, I happen to have a daughter who just started med school on the 30th of June. That has been an interesting perspective. When you've been on the other side of it to think how it works.
Right.
And now I find myself almost, well, it has tweaking my strategies based on what she's going through and
Hmm.
how they're supporting her. When I look at what her first year of med school, the support that they've propped up around her to help her be successful, I immediately am thinking, oh my goodness, what is her expectation? How many years down the road when she hits the workforce? And how
Hmm.
do we start having that conversation too? So I think it's also looking at those types of things. Don't get comfortable with what you think you're comfortable with. Start looking at everything from every angle possible.
Yeah. Yeah. And I think as those folks are finishing their residencies or their fellowships, they're demanding
Hmm.
different things than the class 10 years ago or 20 years ago that we've been recruiting.
Yep, 100%, 100% for sure.
So as we wrap up, you've given us a lot of good wisdom here.
I don't know if anything was on the script, but okay.
No, I've been reading. I've been reading. We're doing all right. We're doing all right.
Good.
So, finally, as we start to wrap up, is there a nugget of wisdom for our listeners who are navigating the workforce challenges today? Is there kind of a wrap up that you would give us?
Oh man, I will. There's two that I always think of that I share with my team. Number one, desperate is a bad place to recruit from. So, and then along with that, take a deep breath and let's figure out how we're going to think about it, how we're going to look at it differently, how are we going to maintain whatever it is we need to do next. But, I always tell my team, we're bright people. We can come up with solutions and we're also human. So let's give ourselves some grace too. So, yeah. So that's I guess what I would say for now. If you ask me next week, it might be different, but that's where I'm at right now today.
Awesome. Well, thank you again for not only sharing your career journey, but these insights and passion that drive your work. It's evident to me just listening to you. So, from leading recruitment and staffing strategies to shaping the future of healthcare workforce management at Essentia Health, your story reminds me really of the actual impact that healthcare recruitment has in not only in placing people in the community that take care of patients, but the innovation and the leadership. You're really guided by that purpose and putting people first. So I appreciate that.
Well, thank you. This has been delightful. Sometimes you have to pause, right? And talk about what you do and then realize, yeah, it is pretty cool, isn't it?
It is. It's very
Yeah.
cool. Yeah, every day. I think it's very cool. So for our listeners, if you enjoyed this episode, be sure to subscribe to Workforce Wisdom on Apple Podcasts, Spotify, or wherever you listen. And if you learned something valuable today, please share it with a colleague who could use a little inspiration in their work. You can also find more resources, including past episodes and healthcare recruitment insights in the PracticeLink Resource Center at practicelink.com. Additionally, we always welcome your thoughts. So if this episode sparked a question or an idea, feel free to reach out to me on LinkedIn or reach out to our media team at plmedia@practicelink.com. I'm Christy Bray, and thank you for tuning in to Workforce Wisdom.